Hello everybody, James Woodall here, and today we're going to talk a little bit about the politics of health promotion and how left and right-wing thinking and political ideologies can impact on the ways we think about and the ways we practice health promotion. Let's get stuck in. Okay, I think it's worth saying at the outset that health promotion is inherently a political activity. And that's really important because when people think about health promotion, they often disregard the impact that policy can have on people's health. So let's start out with a kind of left-wing perspective on health promotion. And it would go a little bit like this. So a left-wing position would be that health inequalities exist, and the reason why we have people in society with living longer than others is because of material and social disadvantage, which impacts on people's lifestyle choices and impacts on the ways that people behave. So a left-wing position would take that premise, and in addressing that would suggest that we need to have collective action to tackle these health inequalities. So a good example might be policies around smoking bans or policies on the minimum alcohol unit price or policies on seatbelts. Those are kind of left-wing ideas that you could associate with kind of health promotion activities. Now, people who would subscribe to more right-wing philosophy in health promotion would argue that it's individuals that should be making choices about their health and the ways that they behave, and that governments and national country executives should not be intervening in people's lives and people's affairs. And they would argue that the state should retreat from anything that was to determine or shape people's health beliefs. So it's a very kind of laissez-faire political perspective, and would see the notion of free choice being absolutely crucial in the whole debate about how we deliver health promotion. So one of the big strengths about right-wing ideas in health promotion is the fact that it gives people autonomy and free choice to make decisions about their lives and about the way that they behave. And that's a very attractive and persuasive idea. But I'd say two things about that. One is that right-wing ideas in health promotion underplay the role of structural and social determinants of health, so the way that poverty and housing and education all impact on people's lifestyle choices and their health. And secondly, right-wing ideas in health promotion tend to be reduced to victim blaming, where individuals are held responsible for their health. And that links back to my previous point, where we know that things like poverty and education and housing all have very strong correlations with health. And so it would seem wrong and somewhat foolish to simply blame individuals for their health and their health choices. So that's the argument against right-wing health promotion. So left-wing ideas in health promotion, as I've said, are those that intervene at a structural or political level to ensure that health inequalities are reduced. Now, the great thing about left-wing ideas in health promotion is that they have a pretty successful track record. So if you look at, for example, the smoking ban in public places, you look at some of the evidence that's emerging around minimum pricing of alcohol, and historically other kind of left-wing ideas about seatbelt legislation, they've all had or show really promising outcomes in terms of community health and population health. So that's a good thing about left-wing ideas in health promotion. Now, the critique from the right against the left in health promotion would be the idea of paternalism, the idea of a nanny state, and the idea that it's individuals that should make choices about their health, not the state. And that's one of the big criticisms against left-wing ideas in health promotion. And that's a really interesting kind of ethical debate to have, and where the state should intervene and where individuals should be allowed to make free choice. But essentially the argument against the left is this idea that we're just reducing it to a nanny state. Okay, so that's my ideas about left and right-wing ideas in health promotion. It's a very complex area. Lots of people have written about this. There'll be an accompanying blog soon about this where I can develop some of the arguments in more detail if people find that useful. Thanks for watching. Take care.